Just a reminder to media on the phone that they may now press star one or any time to line up for questions. The question and answer portion will take place after the speeches, and you have one question and one follow up. I will now invite MLA Kelly Padden to start. Thank you.
Acewell, Telsiaya. Good morning and welcome, my friends. I am Kelly Padden, MLA for Chilliwack, Kent. I have the honor and the privilege to serve on the traditional territories of the Stolo people, specifically the Chilkowiak, Puyallup, and Tate tribes, and I am grateful for the privilege. We're joined here today by some very special guests. Jennifer Whiteside, Minister of Mental Health and Addiction, Mike Farnworth, Minister of Public Safety and Solicitor General, Maureen Levy, Assistant Commissioner, Lower Mainland District Commander, RCMP, Ken Popov, Mayor of the City of Chilliwack, Tina Baker, a psychiatric nurse with CAR 67 in Surrey, and Elder Eddie Gardner of Squaw First Nation. Before we jump into why we're here today, I would like to invite Elder Gardner to start us off with a traditional welcome.
Yes, you kwasa ami tatwalab titlam spas ta homuk squik ta litso kwa ya ami ta as skletlio tam tamio ta hoyok kas palau. My dear ones, it's good to see everyone here today. It's a beautiful, cool day today, and I'm here to give you a warm welcome to the unceded territory of the Tzohwayuk and the Palau people. I'm very honored to serve as counselor with Squaw First Nation, and it's a good day when we have some positive announcements to make, to add some additional supports to our collective mental well-being and address some of the problems, some of the challenges that we have, with substance abuse. We as Wilmot people are severely strained, with all kinds of issues related to these important matters, and we welcome all the additional supports that can come our way. One of the supports that we'd like to see in our territory is the introduction of a healing lodge, a treatment center for specifically addressing the trauma that First Nations experience with the missing and murdered women and children, all the intergenerational traumas that come from stemming from the Indian residential school legacy, and all the maladaptive ways that our people take on, to try and address it with substance abuse that only fuels mental well-being, stress, stresses that go against our mental, social, cultural, and spiritual well-being as a people. And it's so good to know that that this investment is going to make a difference. If it's up to us to make the best of what's coming to us. And so I'm going to bless this gathering and bless the two ministers who are here. And we wish everyone a really good day today, and that we take good advantage of what's coming our way. Oh, see ya. apologize. I can't stay long because I have to go and work with our young people on a project related to Back to the Land, where there's land-based healing going on as well. Oh, see.
Thank you so much, Elder Gardner, for starting us off in such a good way. I am delighted to be here today for this announcement about expanding supports for people in crisis. Our first speaker, Minister Whiteside, will tell us more about that. Minister Whiteside.
Good morning, everyone. Thank you so much. It is such a pleasure and an honor to join with friends and colleagues and partners on the traditional territory of the Stolo peoples, and I too would like to express my gratitude to Elder Gardner for starting us off in a good way and for his very clear and strong voice today. It's wonderful to be in Chilliwack. Such a treat to be with my colleagues and friends, Dan Coulter, Kelly Padden, and of course Minister Mike Farnworth, and all of our partners here in this endeavor. Also, Mayor Popoff, thanks. Nice to see you here this morning. Thanks for being here. On all of the other city councillors and local leaders who are here today. It's also really an honor to stand with Maureen Levy and Tina Baker, experts, frontline experts who you're going to hear from a little bit later, and who have frontline experience to share with us about our really exciting announcement today. But first, I want to note that I think we all understand that, you know, coming out of the COVID-19 pandemic, these are difficult times for folks. We've been through a very volatile period together. The pandemic, the climate-related extreme weather crises that we're experiencing, international instability, cost of living pressures. These are difficult times for people in our communities. And I think there's no question that we're seeing those stresses have an impact on people's mental health. And we know that when mental health challenges and when substance use challenges go untreated, they do lead to crisis. I would say that I think these times call for more kindness, more empathy for ourselves, for people in our community, and certainly for vulnerable people in our community. These are times that call on us to work together in partnership, all levels of government, across our communities, across service providers, with law enforcement, to bring really trauma-informed practices and approaches that are rooted in compassion and taking care of everyone in our community. We know in British Columbia that 1 in 5 interactions with police involve someone with a mental health disorder. And we have heard from law enforcement agencies that they are responding to more and more calls involving people who are experiencing mental health or substance use crises. And we know that they have, as frontline responders, as first responders, long been the default response in these situations. And we have heard calls from all of our partners, from people with lived experience across the province, to know better and to do better, and to recognize that a law enforcement approach doesn't work for everyone or in all situations. We know that we need to bring more mental health expertise, more mental health focused responses, many times along with law enforcement in the situations that require it. And that's why we're here today. I'm really so pleased to announce that we are building stronger services to help people in mental health crisis by expanding our mobile integrated crisis response teams to 9 additional communities across British Columbia. These new teams will be in Abbotsford, Port Coquitlam, Penticton, Burnaby, Chilliwack, Vernon, Squamish, Prince Rupert, and the West Shore. These mobile integrated crisis teams, which in some communities where they already exist are known as CAR programs, are specialized mobile crisis response units that team a police officer with a mental health care professional to respond to mental health calls. And the goal of these teams is to resolve the mental health crisis and those situations collaboratively and in a trauma-informed way. So the kinds of things that these teams do in terms of the approaches that they bring to crisis situations are to employ verbal de-escalation, involving the community, the family, the friends, the support network for the individual who is in distress, determining what the appropriate pathway for the next step in care is required, whether that's hospital or community services. And the healthcare worker is on the team is able to provide that on-site mental health and emotional assessment and crisis intervention, while the police officer can look to any safety concerns and ensure that that everyone involved in the situation is safe. It is so important that these teams, the role that these teams play in connecting people in distress to the healthcare system, not the justice system when that's not necessary. They connect them to the supports they need and deserve during often a very extremely vulnerable and traumatic time in their lives, helping them move along the next step in the pathway to well-being. Similar teams are currently operational in every health authority in a number of communities, in Vancouver, on the North Shore, in Richmond, Surrey, Kamloops, Kelowna, Prince George, Victoria, Nanaimo, and we know that they are making a real difference in these communities. I can't really say enough about the incredible collaboration and the important relationships between our health authorities and our law enforcement partners, my Ministry of Mental Health and Addictions and the Ministry of Public Safety and Solicitor General that makes these teams possible. Our government believes deeply that investing in programs that strengthen and improve services for people based on work that pulls all of our partners together and that builds on work and good practices that are already happening in communities. These teams are an important part of our government's work to increase supports for people with complex mental health and addiction challenges, while at the same time we are working very hard to build up a system of integrated mental health and addictions care that we know did not exist 6 years ago. And that is part of our $1 billion commitment in this year's budget to build that system that involves complex care housing for people with overlapping mental health, addiction, trauma, and or acquired brain injury who may be experiencing homelessness or be at risk of homelessness, expanding concurrent disorder care, adding new addictions treatment spaces throughout the province, investing in community counseling. Our health authorities are working so hard every day to scale up the services we know people need. We also are investing in peer-assisted care teams, which are purely mental health crisis de-escalation supports in communities. We know that there is so much more to do, and these teams announced today are really just one tool of all of the work that we are doing to support people with mental health addictions in our communities to make everyone feel safe and cared for in our communities. Thank you very much, and I will turn it back to my colleague, Kelly Patton.
Thank you, Minister. As the MLA for Chilliwack-Kent, I'm grateful to be here for this announcement and to know that these supports are coming to our community. This means that people who are at an extremely vulnerable point in their lives will be met with care and compassion. And if they choose, they'll be connected to voluntary services and supports on their pathway to well-being. I'm grateful to you, Minister Whiteside, for bringing this invaluable service to our region. I know these teams will not only support people in crisis, but also help to keep our community safe. Now, I'd like to invite Mike Farnworth, Minister of Public Safety and Solicitor General, to speak.
Thank you, MLA Patton, and good morning and welcome everyone for joining us here today. I'm Mike Farnworth, the Minister of Public Safety and Solicitor General for the province, and I'd also like to, it's my pleasure to be alongside my colleagues, Minister Whiteside, Kelly Patton, the MLA for Chilliwack-Kent, Dan Coulter, the MLA for Chilliwack, Mayor Popov of Chilliwack, and Maureen Levy, the Assistant Commissioner for the Lower Mainland District Commander, and Tina Baker, psychiatric nurse from CAR 67 operating in Surrey. Today's announcement's important because when people are in crisis because of mental health or substance use challenges, we want them to be met with care and compassion. For many years, police departments in this province have been working with community partners to lessen the impact that these crises can have on communities, on policing resources, on healthcare services, and most importantly, on those British Columbians living with mental health and addiction challenges. In our province, many interactions with police involve someone with a mental health concern. Currently, police have been the default first responders for people in the event of a mental health crisis. And we know that in most cases, police-only involvement is not the most appropriate response. More importantly, having police-only involvement can help contribute to the stigmatization of mental health and even deter people in crisis from seeking help. We recognize the value of police officers working alongside mental health experts best serves those who are in moments of crisis or distress. Mobile Integrated Crisis Response Teams, also known as the CAR program, partners a specially trained police officer with a mental health professional to respond to mental health related calls. They respond to requests from patrol officers and assertive outreach team members for mental health assistance. And by working together, they determine the most appropriate course of action in each case, so that each person receives the specialized care that they need. Demands on our police officers continue to grow. Every day they demonstrate their dedication and adaptability, responding to challenges with professionalism. And I'd like to take a moment to thank them for their ongoing dedication to keeping British Columbians safe and our communities safer. We've heard from many police departments and health authorities who currently run mobile integrated crisis response teams that they are making a significant difference in their communities. But they're struggling to keep up with the demand. It's clear that there is a need for a better and more timely access to the healthcare system, not the criminal justice system. And today's announcement is bringing more mobile integrated crisis response teams to more communities. $3 million to expand mobile integrated crisis response teams into 9 communities in BC. These teams are creating greater response options for mental health crisis calls. They will connect people in crisis to the appropriate services in their community, and they will help take pressure off stretched police resources so that they can focus on serious crime. These expanded services complement our ongoing work to support our province's most marginalized people, while helping to alleviate the strain on police and police resources in areas with critical vacancies, as well as continuing our work to build a comprehensive system of mental health and addictions care. We need to make sure that people feel safe everywhere in our province, and it's one of the top priorities for our government. There's still plenty of work ahead of us, and I can assure you that we are continuing this work on all fronts with all levels of government. Because when we work together, we're building safe and healthy communities for everyone. Thank you.
Thank you, Minister Farnworth. I would like to now invite Maureen Levy, Assistant Commissioner, Lower Mainland District Commander, RCMP, to say a few words.
Good morning, everyone. First of all, what a privilege and a pleasure to be here today. I am here representing the RCMP as the Lower Mainland District Commander, overseeing all of our Lower Mainland RCMP communities. I'm truly honored to be here today and to speak about an exciting expansion on a partnership between the RCMP, our health authorities, and communities throughout British Columbia. The Safer Communities Action Plan will allow cities not only within the Lower Mainland, but also other parts of BC launch the Mobile Integrated Crisis Response Teams. Today's announcement formalizes the significant work that has been done between police and health authorities here in the Fraser Valley, in the Okanagan, up north in places like Prince Rupert and on Vancouver Island. These specialized teams will pair our police officers with mental health professionals to respond to mental health and crisis calls. Police will be supported by nurses and mental health professionals to conduct mental health assessments, crisis intervention, but also refer people to access the services they need within their communities. As previously mentioned, police are responding to an ever-increasing number of calls for service that have a direct nexus to mental health-related concerns. We have seen success when we approach the issue in a trauma-informed and collaborative way that prioritizes care and not enforcement. Our communities and police officers will truly benefit from future MICR teams, and for those who are vulnerable experience mental health crisis and addictions. We are truly better when we work together as one team. People first, one big team is also my personal motto, and it has been since I joined the first force over 35 years ago. We are grateful and look forward to our working with our health authorities to launch mobile integrated crisis response together as one big team, and thank you very much, and what a pleasure to be here. Thank you.
Thank you so much for those important words. I would like to now invite Mayor Ken Popov to speak.
Good morning, everybody, and this is truly an exciting day for the city of Chilliwack. We have been advocating for this type of a program for a few years now. It falls in line with our community action plan on the crime side of the house and on the mental health side of the house as well. It's welcome news for our community. I want to thank the province for their bold move and aggressively taking these challenges on. And it is certainly going to help the city of Chilliwack moving forward. I was going to ask, is the ACT team next maybe? But let's go with this and just keep on rolling along with this strategy. Thank you to the province for coming to the table and working with our community. Thank you very much.
Thank you, Mayor. Our next speaker knows the benefit of connecting people with the proper mental health and substance use supports after a crisis. I would like to invite Tina Baker, a psychiatric nurse with CAR 67 in Surrey, to share her story.
Thank you very much. Hi, everybody. Thank you so much for having me. Thank you for the invitation. My name is Tina Baker. I'm a psychiatric nurse. I've been working for Fraser Health for the last 20 years, and I've been working for the CAR 67 program for the last 12 years. I'm thrilled to hear the announcement for more mental health crisis teams expanding in our province. It's long overdue, and there's many people out in our community suffering with mental health issues and not knowing where to turn to for help until it's too late and it becomes a mental health crisis. It's been an honor for me to work alongside law enforcement to reach the most vulnerable people experiencing mental health crisis for the last 12 years. And many people, as I've mentioned, do not know how to access mental health services until it is too late, and then the police and law enforcement are involved in that care, and it's a benefit for having us as mental health professionals being able to access them and help them as well. Being in the CAR 67 program and working for Fraser Health, I do have access to medical history, and it's a wonderful tool to help us prepare for all of our interactions with people that are suffering from a mental health disorder in the community. The ability to assess individuals within their own space and comfort zone and away from a clinical environment allows us to slow the interactions down and allows that person in crisis to process that experience and allow us to de-escalate and use trauma-informed care. Many individuals' mental health crisis will heighten when law enforcement is present, and when the CAR 67 team and the mental health program does come to these files, it does more often than not de-escalates the situation. The ability for us to work within a multidisciplinary team and have the healthcare and law enforcement work in sync is going to be a tremendous gift to all of these communities. Working with family members as well as the loved ones experiencing the mental health crisis is also a huge benefit for us in the community, because most often the loved ones are suffering just as much as a person that is in crisis. I am just excited. I haven't been able to sleep well for the last 3 days trying to keep this a secret. My colleagues will be shocked to see me standing here. So I'm sorry. I couldn't do any of this work without my team. I have about 16 police officers on my team. There's 3 of us nurses, Stacy and Ashley. I couldn't do any of this without any of you guys, and I'm thankful for the support and the ongoing support that's going to be growing. Thank you very much for having me.
Thank you, Tina, so much for sharing your experience and the surprise. This brings us to the end of this morning's events. Again, thank you to Minister Whiteside, Minister Farnworth, Maureen, Mayor Popov, Tina, Elder Gardner, and I I can't not acknowledge MLA Coulter, my partner here in the Chilliwack area, who we've been advocating for this for a while. So great news all around. We will now take questions from the media.
Thank you. Yeah.
There we go.
There we go. Just a reminder to reporters on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up. Please also remember to take your phone off mute. You are not audible until your name is called. Our first question is from... Sorry, I was a little bit confused here. Camille Caramali, Global News.
Hi there. Good morning. Thank you for taking my question. This question is for Minister Farnworth. On Saturday, a senior with Alzheimer's went missing, who was missing in Coquitlam for 5 days, was found. Search and rescue teams and family have said that a silver alert system to notify the public of a missing senior would have helped greatly. You had made this promise years ago. Where is this, or the NDP had, where is this in its implementation, and why hasn't it been used yet?
No, thank you for the question. The silver alert system is something that we have been looking at. There are a number of challenges with it and the alerting system in terms of how something would be put in place and how to be able to put it into a very, very small area. We have had the focus has been very much to date on the alert system in terms of natural disasters such as fire and floods. We are still interested in the silver alert system, but there are some issues that obviously we identified in terms of the bigger picture that we need to be able to look at and how we would do something on a very small and local area. One of the challenges with alert systems is that if they come on too often, people ignore them. And so we need to find a way in which we could do something that people don't ignore, but also recognizes, but targets it to a very specific localized area.
Camille, did you have a follow-up?
Thank you. Yes, I do. Thank you for that. My follow-up to that is there has been, an increasing number of seniors, according to search and rescue teams, that have who have Alzheimer's, who have gone missing. There's an increased need for this, an increased call for this. So with years into what once was a campaign promise, why haven't those challenges been looked at into deeper, and why haven't they been addressed yet? It looks like it's not a priority if those challenges still persist and haven't been addressed or looked into.
As I said a moment ago, those challenges relate to, one, the kind of technology and how we want to be able to target it to a specific area. We've seen, for example, with amber alerts that are broadcast province-wide. We've seen it with the fire alerts and with and around flood, is being able to target it to a specific area. And that issue of people of ignoring it because it happens on a regular basis. That's one of the issues that we really need to try and find a solution to. That being said, there are advances in technology that may assist in terms of individuals in being able to keep better track of where someone is. But it's something that we're still concerned about, something that we're still would like to see in place. But if it's going to be implemented, it would have to be implemented right so that it works.
Next question, Katie DaRosa, Vancouver Sun.
Hi, this message our question is also for Minister Farnworth. The Toronto Star had a story reporting that the federal government is considering transforming the RCMP into a FBI-like police force that focuses only on national security issues, terrorism, and gets it out of the game of community policing, contract policing to smaller communities. What are your thoughts about whether this is the future of the RCMP, since BC has the largest RCMP complement?
police reform is an important issue, and it's an issue at the local level, the provincial level, and at the national level. I know at the national level, my federal counterpart, the federal minister, it's in his mandate letter to look at review contract policing in the same way that similar things are in my mandate letter in the terms of the future of policing in British Columbia, both from a municipal and RCMP level, and then of course the issue that I'm dealing with in Surrey. I think it's important that we do have these kinds of discussions on police reform and how policing evolves. Just as society is changing and evolving, so does policing. But one thing I do know, that however policing evolves, both in this province and in this country, the men and women who are police officers do an incredible job and will continue to do an incredible job.
Katie, did you have a follow-up?
I mean, what are your concerns about the vacancy rates among the RCMP? Obviously, you said that that's going to be a consideration for the decision in Surrey, is that whether they're going to be poaching officers from other areas. But when you look at the 200 officer deficit of officers leaving the force compared to officers graduating from depot, what does that say about the level of the vacancy rates and whether the RCMP has enough members to provide the adequate safety?
The issue of vacancy rates is something that we've been very concerned about here in British Columbia, but I also know that other provinces as well, whether it's Alberta, Saskatchewan, Manitoba, or the Maritimes, it was an issue that's been identified in a number of reports in terms of dealing with the RCMP, but also policing in general. And so any discussions that take place around the evolution of policing, the reform of policing, modernization of policing, however you want to discuss it, has to recognize that we are facing some significant challenges when it comes to vacancies, when it comes to policing in terms of our rural and small communities, whether it is the federal policing line, as it's referred to, or the provincial policing line, and at the municipal level. That's one of the reasons why we committed the funding which we did to be able to fill the 270 vacancies that we have in rural and small town policing here in BC. And that was an ambulance siren, not a police siren.
Our next question is Mira Baines, CBC.
Sure, Minister. Thank you for taking my question. This is for Minister Farnworth. What words do you have for the family of a 9-year-old boy in a 100-mile house? The coroner is investigating whether the cause of death was severe asthma attack exacerbated by wildfire smoke. And can you just speak more generally about the public safety risk of wildfire smoke on our health? For example, should people with asthma not go outside when it's smoky? What are your words for this family, and what's the advice right now?
First off, this is obviously a terrible, terrible tragedy and every parent's worst nightmare, and our thoughts go to the family at this very, very, very heart-wrenching time. I know the coroner will be doing the coroner's report and doing a full investigation. That's their role, and we will want to wait to see what comes out from that. I think it's important also that during fire season, whenever we've seen some unprecedented fires, particularly in northern British Columbia, that have generated significant amounts of smoke, to follow the advice of our public health officials when it comes to air quality. It is monitored on a daily basis, and that I think people need to pay attention to that. But again, this is just a terrible, terrible tragedy for the family.
Mira, did you have a follow-up?
Yes, and this question is again about policing in BC, in particular in Surrey. Minister Farnworth, have you had discussions with the federal government on the direction that you plan on taking with Surrey policing this week? We understand that you will be announcing something this week. So we're wondering, how much of a role has the federal government's input had on your decision or what you're planning on announcing this week?
So I will be announcing a decision on Wednesday. What I can tell you is that there is a tripartite agreement that has been governing the transition to date. The federal government is very much a part of that, Public Safety Canada. I do update I have spoken with the federal minister over the proceeding, ever since this started. And I will be talking with the federal minister before Wednesday.
Our next question is Martin McMahon, City News.
Yes, a couple of questions for Minister Farnworth, and just following on from that question on Surrey Police. So you're saying a decision is going to be announced on Wednesday. Could you just expand on what exactly that will look like? I'm not asking for the definitive answer here, but just a general sense of what we can expect.
You can expect I'll be making a decision and announcement on Wednesday.
Martin, did you have a follow-up?
Going back to the silver alert issue, you've highlighted the challenges here, but I guess we're trying to get at here, is this still a live issue, or is this still actively being looked at, or has the decision been made to move on from it?
No, there's been no decision made to move on from it. I think all of us want to be able to put in place systems that work to assist, whether it's law enforcement or search and rescue. But what's critical is that you do it in a way that people pay attention. What the worst thing that could happen would be to have, in essence, the car alarm syndrome, where it goes off and no one pays attention. And that's one of the challenges with increasing the number of alerts that can go out, and so it need to be put in place in such a way that you're able to target it to a very small, local, specific area.
Our next question is Wolf Deppner, Black Press.
Yes, thank you for taking my question. Question regarding the teams, the car teams. How did the province choose those specific communities? Which criteria did it use to determine that those municipalities, those areas, should receive these types of teams?
Thanks very much for that question. We work very closely with municipalities, with health authorities to determine sort of priority areas and areas that are ready, areas that have the resources ready to go to build these teams. So we're looking at number of mental health calls that police are responding to. We look at the experience of our partner service providers with respect to mental health issues. And again, this is the first part of an investment coming out of our Safer Communities Fund that was announced in November.
Wolf, did you have a follow-up?
Thank you. When do you expect these teams to come into effect? Which community will sort of be at the top of at the start of the line, and which community will be sort of the last?
Well, one of the key criteria is readiness, and so I know that that the municipalities are very anxious and ready to get going with building the teams, and that they'll be working very closely with their health sector partners to get those positions posted. So I think we can anticipate that in fairly short order, those teams will be up and running.
Our next question is Mike van der Bosch, Fraser Valley.
Good morning. This question is for Minister Farnworth, and thank you for taking my question today. Elected officials in Chilliwack have expressed concern in the change to the South Coast Highway Patrol Service model. Hope RCMP and Chilliwack RCMP will now be required to respond to accidents on the Coquihalla and Crow's Nest Highway effective September 1. Is there any reason the province is allowing this to move forward despite concerns raised by elected officials in Chilliwack? Thank you.
Thank you for the question. I'm going to be meeting with the city of Chilliwack later today to discuss that issue. On the broader issue of highway patrol, what I can tell you is one of the areas that we are looking to expand with the investment of the $230 million to fill those provincial RCMP vacancies is to expand the capacity of the highway patrol system. But I will be meeting with the city of Chilliwack later this morning.
Mike, did you have a follow-up?
Yes, please. Thank you. The $3 million funding announcement for the car teams, will this fund police officers as well? And will these be ongoing operational funds? Thank you.
No, these funds are funding the health component of the program.
Okay. Our next question is Ashley Joannou, Canadian Press.
A little bit more clarity on the timeline for this program. Minister Whiteside answered that it would be up and running in fairly short order. I'm hoping for something a little bit more specific than that. With the ongoing struggle for staffing in the healthcare system, how many new nurses do you need to hire, and what's a reasonable expectation for when you could actually get these people on the job?
Yeah, so just to again say that that municipalities and health authorities have been working together with respect to the planning for these crisis intervention teams, and these positions may be nurses, they might be social workers, they might be community mental health workers. A determination will be made by the parties in the community with respect to what the best approach is for that particular community, and I would expect that health authorities would be proceeding to post positions again very soon to get the recruitment process started, and I'm confident that municipalities are already working with their local policing agencies to have the plans in place very soon for the policing part of the team.
Ashley, did you have a follow-up?
Yeah, the follow-up is for Minister Farnworth. I'm wondering if you could give us a little bit more detail on the military supports that are coming in to help fight the wildfires. Can you give us a sense of where specifically they're being deployed and how many new boots on the ground you're expecting?
Thank you for that question. So, when the federal government sends Canadian Armed Forces to assist, it will be coordinated between the province and the federal government, and also in terms of what's happening in other parts of the country as well, in terms of the resources that are available. In terms of how they're deployed, that is something that's determined by the fire service in conjunction with the Canadian Armed Forces in terms of where the best place and where the need is required, and so that's how those decisions are made.
Our next question is Richard Zussman, Global News.
Thank you so much. This is for Assistant Commissioner Levy, who I think is still there. Assistant Commissioner, I'm just wondering how complicated you think it would be to transition the RCMP away from community policing to a federal force similar to the FBI in the United States.
Well, thank you for that question. That's a very difficult answer to give today. I can tell you right now, we are the provincial police force in British Columbia, and we work in close concert with our municipal partners, our communities, our municipalities, to make sure that we provide the best possible service for public safety. We can't do it alone. We need to count on each other, and we have municipal and federal resources in British Columbia as well that also aspire to that and will provide assistance when required.
Richard, did you have a follow-up?
Yeah, and for Minister Farnworth, how worried are you about your decision on Wednesday having an impact on that essential relationship that has existed for the long time between the province and the RCMP?
Look, I know this is an important decision, and I also know this. Police agencies, whether they're municipal or RCMP, are professional organizations, and that however the decision comes down on Friday, I know that the men and women whether municipal and in the RCMP are going to continue to do an incredible job both professional organizations that have provided policing services, and so I have every confidence that they will continue to do that important work that we all depend on.
Our next question and last question is Sophie Chevanche, Radio Canada, CBC.
Yes, hello, hi. It's just like regarding the wildfires. I would like to have more details about like the need, the help that we need with the Canadian Army. Could you tell us like what kind of help do we need exactly?
Well, whenever in this country we have a fire situation in any year, but particularly what we've seen in the last number of years, we are able as a province, as all provinces are, to draw on resources from across the country. There is the central command that takes place in Winnipeg in terms of the allocation of firefighters from out of province and out of country. So we have reciprocal arrangements, for example, with a number of countries. The United States this year has been able to assist us, unlike previous years. Australia, New Zealand, and Mexico are all able to provide firefighters as well, depending on the situation that exists in other provinces. We may well see firefighters coming from those jurisdictions. So that's in place. At the same time, we also know that we can count on the Canadian Armed Forces to be able to assist in terms of a lot of the work that needs to be done. While they don't necessarily fight the fires on the front line, they can provide important work to be able to allow the firefighters to do the work that they need to be doing on the ground. That's coordinated with the federal government, with the Minister of Public Safety, and as I said, they make those determinations and what they're able to supply depending on the needs of particular provinces and the situation that is occurring across the country.
Sophie, did you have a follow-up?
Yes, I do. Last week we asked for 1,000 additional firefighters here. Could you tell us how many people, like help, do we have right now? Like how much people did we receive?
Well, over the course of a fire season, and again, it depends upon the severity of the fire season. It depends on how the fire season has evolved. Will in part dictate the number of firefighters that you have on the ground at any one time. In a typical fire season, it could be somewhere around, between 3,000 and 4,000 people, as we've seen in fire seasons in the past number of years. And given the scope of what we're seeing so far this year in terms of fires, it'll probably be closer to 4,000 people at its peak.
That's all the questions we have for today. Thanks everyone for joining us. And we are going to move the podium for a group photo. Thank you. Have a good afternoon.